pleasure to be here and to moderate a discussion, or a fireside chat, I should say, with three esteemed colleagues. Last year when I moderated the fireside chat, we had a more conducive setting in that we had some nice armchairs. It was quite relaxing. This is a little bit more formal, but I thought we might be able to set the mood a little bit. Brian, can you help with that? Perfect. And next year, we'll distribute mugs of hot cocoa to accompany this. So we've heard from all of you. The audience has spoken and has shared with us a list of policy priorities or initiatives that on which we as a sector need to act. And I think it behooves us now to reflect on what we've heard from the vantage point of the entrepreneurs and innovators who will ultimately realize the benefits, the priorities, the policy priorities that you've described. We need to hear from the policymakers who will be charged with implementing those policies, and we need to think about how the advocates who will be charged with mobilizing our sector can make that case for change. And so to support this discussion and provide some insight, we have a really wonderful panel of fireside chatters. We have Wendy Cukier to my immediate left, who's the founder and director of the Diversity Institute at Ryerson University and one of Canada's foremost experts on disruptive technology, innovation systems, and diversity. We have Giles Gherson, who is Ontario's Deputy Minister for Red Tape and Regulatory Burden Reduction. He brings over a decade of leadership within the Ontario Civil Service in areas such as economic development and growth, innovation and science, and small business. And Huda Idrees, who is an industrial engineer and entrepreneur, founder and CEO of Dot Health, and also a member of the federal government's Health and Biosciences Economic Strategy Table. So join me in welcoming these speakers. So we asked the question, what is the single most important action the Government of Ontario can take to foster the emergence of a Made in Ontario billion-dollar biotech success story? And the top 5 priorities on which you voted were 1, alignment across ministries; number 2, adoption of a life sciences strategy; number 3, journey mapping to support red tape reduction; number 4, FDA, Health Canada harmonization; and number 5, tax incentives to encourage private sector investment. Though I would also point out that if you look at the distribution, there were about 4 options that related to the same thing, which was technology adoption, innovation adoption. And if you add up those 4, that is the second place winner in the policy priorities. So I want to begin by just gathering reactions from this table to the results that we've heard. Do the results of the engagement session actually resonate with you? Are these, for you, the priorities that are needed to unleash the potential of the life sciences sector in Ontario? And what do these priorities tell you about the mood of the life sciences sector in Ontario? Maybe I'll start with you, Wendy.
I was going to say I demand a recount, but you gave me one. So if we include the adoption side, because I think demand, as you know, is just as important as thinking about the supply side, I think these look pretty good to me. I think the government to adopt a life sciences strategy, there can be a lot that's packed into that, but I think it looks to me like the audience is pretty sensible and that the recommendations really align with the evidence with that amendment.
Thanks, Wendy. Giles?
I'd agree with Wendy in the sense that I kind of thought we might see lots of requests for government incentives, for example. That's often been an important consideration in the past, and it's not a wrong one, but I think there's probably a recognition in the room that the government has a pretty intense fiscal balance agenda, and at least for the next couple of years, and wants to move pretty quickly on it. So new government grants, for example, programs like that that we might have had in the past, I think are going to be hard to come by, and that's not impossible to come by, but hard to come by. And so that's probably a wise sort of sense of the room here, that let's not push for that. I thought that the other elements that received wide support here in the room really did kind of, in many ways, suggest the building blocks of a life sciences strategy. When you think about procurement, for example, I mean, that is an important tool. It's one that the previous government began to work hard at. With Bill Chernetsky is here, and I think his role was a very important one in terms of opening up the system to the products and services of emerging life sciences companies. There may be a different approach in this new government, but I think it's obviously always going to be an important part in a public healthcare system of a life sciences strategy. I think intellectual property, the protection of intellectual property is something that, from a bureaucratic point of view, we were working hard at in the last government. We had a bunch of roundtables, and we're looking at how to develop in Ontario, working with the federal government, I should say, quite closely on an intellectual property strategy. And so I think that you can't have there's concern about IP and flowing out of the country. So we develop it, and then we, in a sense, buy it back in the form of products. That's something we do have to kind of change. Flow-through shares and other tax incentives. Well, flow-through shares is a long-standing, I think, request of this sector. I know that it's something that the previous government looked at. The finance ministry of the day had concerns about the cost. Or where you would it be purely for life sciences? Would it be for technology companies in general? And how large would, what kind of foregone revenue are we looking at? I think it's still an interesting prospect, but you have to think about the cost. Clinical trials, obviously very, very important. So, and harmonizing, from my perspective, the idea of harmonizing Health Canada, FDA product licensing, to me, makes a lot of sense. In the role that I'm playing right now, a lot of it is about alignment between different jurisdictions and trying to get out of businesses that other jurisdictions are in, and certainly that and disentangling with the federal government. So that strikes me as an important one. Just say quickly on journey mapping, we've launched about 5 journey maps already in the last several months, looking at different companies. We haven't got a life sciences one yet, but we've already done 4 or 5, I think. Hugely insightful in terms of what regulations look like on the ground. So that was a smart suggestion. Appreciate it.
And Huda, and particularly given your recent experience at the federal table, I'd be interested in your reaction.
Yeah, for sure. I think it's difficult. Canada is set up kind of awkwardly, where we have this, we have the federal government, and then all the provincial governments kind of do their own thing, and there's not a lot of harmonization across that. And what's interesting is all of the suggestions, if you can take them sort of like a step above, is all of the suggestions we came up with at the federal table as well. So like A+ on alignment on those, which is really good. So excited to see that. As the founder of an Ontario-housed company, I think it's exciting to see alignment amongst people who are also operating in this space. I think it's interesting when we talk about adopting a strategy. There's strategies get a bad rep because they're often like documents or just a report. And coming from the HBES table, which is the federal table, we kind of put out a report, and now we're like, okay, well, there's another document, and we have a ton of those in Canada. What does it actually mean when a government adopts a life science strategy? Are we trying to make the life sciences sector in Ontario an economic front runner in the province? Is that what we're trying to do? And I think we need to be, specific about that when and if we talk about it. The Health Canada and FDA harmonization came up a lot on the federal table, and happy to speak to that specifically, because we had industry people who had suffered through tons of red tape just trying to get their products through all of those clearances, and they could get through it so much faster in other geographies, and that was a big problem. What are we doing when there are similar frameworks that countries like Canada have already approved? What can we do to fast track it then when they come to Canada instead of trying to start from scratch, which is a lot of what we do. So that's a big piece of the report for sure.
Wendy?
Yeah, I was just going to pick up on that because I think that the issue is not just the approval. Innovation is not about making new stuff or even getting it approved. Innovation is about using things to drive change. And it's not that I don't think that everything that's been talked about is important, but I chair the board of one of our hospitals, and I really think that a lot of the barriers to developing markets for technologies and innovations that are developed in Ontario are massive, and that's why we see so many startups going first to other jurisdictions to get their first customers, because navigating through the procurement processes at hospitals which are Byzantine, is a real problem. And I do think that the provincial government has a very important role to play in terms of driving innovation. And I really liked one of the points, I forget which group brought it up, which was the idea of the cross ministerial strategy. When I think about the strategy, I agree with you completely that strategies are just words on paper. But the notion that if we're talking about a health sciences or a life sciences strategy, it has to include a strategy around healthcare and how we're going to transform healthcare using the tools that Ontario companies are developing. And we're going to find ways to incentivize the adoption, the testing in this country, not in Singapore and not in California, I think is really important, because if our startups have to go to the Valley in order to get funding, and they have to go to LA in order to find markets, then chances are pretty soon that's where they're going to go to live as well. So I sound like a broken record, but I've been in this space for a very long time, and I can show you quotes talking about the transformative effects of electronic health records from 1990. And we're still, as many of you have heard me say this over and over, it's easier to make a restaurant reservation in Toronto than book an online appointment with your physician, and 70% of doctors don't think patients should have access to their own health records. So the issues in that very little piece of technology adoption are purely behavioral, organizational, and institutional. And so we're trying to position Toronto as the epicenter for AI-enabled transformation and lots of amazing work going on. Look at the trajectory of an adoption of electronic health records. Do we really think we're going to see AI transform healthcare in this province without some very serious rethinking of processes?
I think it's an excellent point, and Giles, this is really inherent to your new mandate within the province to facilitate the overcoming of some of these gratuitous barriers to adoption, to foster the kind of regulatory harmonization that's needed to support the sector. How do you see this sort of fitting in more specifically into what you're doing, and how can our sector work constructively with your office to effect the kind of change that will be needed?
Well, what we've done is we've gone to the government with an action plan, which is essentially a 2-year action plan. I mean, I think when you think about regulatory reduction, it needs to be done in the first part. It's like fiscal spending reductions. They should be done early rather than later, or they're not going to get done probably. So, so you need to move quickly. And so we have pretty much a 2-year plan. What we're trying to do is reduce regulatory burden by about 25%, which is significant over those 2 years. And so what we plan to do is have a series of really semi-annual packages of burden reduction measures, both legislative and regulatory. So the first one, we've actually had a first little bit the other week with Bill 47, and then we've got a package coming probably in the next couple of weeks, which will be quite large. We'll do a spring package, another fall package, and a spring package after that. And hopefully what we're doing is we're talking to ministries and ourselves. We're talking to a lot of stakeholders. What we're really trying to do is understand the most pernicious regulatory barriers, the ones that are, first of all, old. We have a lot of regulations that are 10, 15, 20, 30 years old, and technology has completely changed, but we've got these highly prescriptive regulations that then when we have inspectors come, they say, they've got to make it up because what they see on the ground doesn't fit the rule book that they have to enforce. And so we really need significant modernization of a lot of regulation or streamlining. We need to get rid of regulations that don't make sense anymore. I think there's probably a strong sense that Ontario is an over-regulated jurisdiction. I mean, we have something like 380,000 regulatory requirements. British Columbia has about 166,000. British Columbia is a pretty well-managed jurisdiction, so hard to see why we need that many. And I think there are a lot of regulations that cropped up in Ontario over the last decade and a half, maybe, that were a result of a single incident. And so, in many ways, and not that those new regulations actually minimize risk, but they provided comfort to people. This won't happen again because here's 55 new regulations that we put in place, and I'm not making that up. And then you're stuck with all this burden, and sometimes these are a result of criminal acts, not regulatory failure. And so finding those and eliminating those, disentangling from the federal government and municipalities are key. Procurement reform is part of that. So we're looking across the board. We are talking to a lot of stakeholders. We're kind of going in some way sector by sector. And we have started significant conversations with the life sciences sector. A number of important barriers have been raised with us, but I'm sure there are many more. So we plan to spend a fair bit of the next couple of months talking to the sector so that we can put what we find into a spring package.
Huda, I want to turn to you as a founder and a CEO of an innovative company in Canada, .Health, a company that is really transforming how patients access data, empowering patients with data. As you think about the next stage of growth for .Health, what's most important to you to achieve the kind of scale that you feel you can and should achieve?
That's almost like a trick question because I think we need to grow outside of Canada in order to scale. Because we've been, and it's not about like access to all of the people who are decision makers. It's the unwillingness to actually change quite quickly. Mm-hmm. So this is like my favorite anecdote, but I share it all the time, which is one of the first things before we'd incorporated .Health. This is roughly 2 years ago. I went to a couple of key decision makers in the provincial government around health, and I said, well, why does this thing not exist? Can it exist, and why doesn't it? And they were like, yeah, come back in 8 years, and it will be there. And I was like, well, this idea is like 8 days old in my head, so how do you expect any company to keep going for 8 years waiting for somebody somewhere to change? So I think yes, we should have reform on regulation, and I'm really glad to hear that it's on a timeline that makes more sense, because without that, companies like mine that are tiny, we're less than 2 years old, can't survive. And some of that is alignment, yes, across all the different jurisdictions that we operate in. So .Health is available everywhere except Quebec today because we're not bilingual. So everywhere in Canada except Quebec. And when we think about expansion, we think about all of the areas that we could go to where we could get regulatory approval faster. Mm-hmm. So it took us 8 months to actually do this like circus interpretation of all of the legislation that pertain to every single province and all the federal regulations around protection of data and movement of that data. And all of those regulations and legislation are from like the early 2000s when the iPhone didn't exist. So the fact that we're talking about innovative technology, when we talk about AI, it's laughable because we don't even have like regulation around what it means to move a piece of data from one place to another. So we're talking about applying intelligence to vast amounts of data. Good luck with that. Not to be a Debbie Downer.
And I'm wondering, Wendy, building on Huda's comment, can you help us to think outside the life sciences box for a moment? Because you've dedicated your career to understanding how innovation systems work. I mean, are there lessons to be learned in terms of how we can change the culture of decision-making, the appetite for risk, the willingness to adopt and implement quickly that's needed to scale companies like Health.
You know, I was, because most of my work is actually in ICT and telecom rather than pharma or medtech, and I know that especially in pharma, you know, the investment cycle can be billions of dollars and the time frame can be 10 or 20 years. But so my comments are really more related to ICT-enabled kinds of technological innovation. I think you have to tackle it at a systems level. You have to really understand, you know, in the same way you were talking about journey mapping through the government, you have to think about journey mapping through markets in order to get adoption in healthcare, because I do find, and I've worked with a lot of the incubators and a lot of the programs that invest in research and commercialization and so on and so forth, there is really a lack of attention on markets and the processes that are required to break into the markets, first of all. Secondly, our healthcare system doesn't work like a system. It's incredibly fragmented. There are no incentives. You know, the government funding models provide absolutely no incentives to innovate because of the way in which they're structured. So I'll just give you a really good example, which is part tech. You know, Women's College Hospital is an ambulatory care facility. We do stuff in 18 hours. As my chief of surgery refers to the other hospitals as expensive hoteling and catering services. And we can do now hip replacements and knee replacements in an 18-hour cycle, potentially saving the system an awful lot of funding, a lot of money that could be reinvested into things that we think are much more important, you know, more access, better treatments, whatever. There's zero incentive for scaling those kinds of new procedures. And, you know, so when we think about things like how artificial intelligence can improve diagnostics in radiology, or can improve and reduce errors in the administration of anesthesiology and free up anesthesiologists to work in the pain clinics that have, you know, like century-long waiting lists, I think, or where we can start to use AI-enabled applications to provide different kinds of mental health supports, and there are lots of companies starting to work in that space as well. Again, not replacing access to highly trained psychiatrists and so on, but triaging out some of the things that can be handled more easily, you know, et cetera, et cetera, et cetera. When you think about the opportunities to transform the healthcare system and tackle the hallway medicine problems, some of it's changes in processes, some of it's new technologies, but fundamentally, there are no incentives. There are no incentives to the healthcare system to drive change. And that has to be partly government, that has to be partly leadership, that has to be partly the systems of remuneration for physicians, you know, awareness, consumer demand, et cetera, et cetera. And in my mind, finding ways to disrupt systems, and I have this similar analysis for post-secondary education, don't get me started. But finding ways to disrupt systems requires people working together. But more than anything, it requires evidence. It requires not just a strategy, but real targets, real accountability, and real transparency. Because I have seen the very same innovation strategies written every decade under somebody new saying almost exactly the same thing, and we aren't any further ahead. So I do think, it's a long sermon, but I do think going back to the, you know, one of the top recommendations, which is alignment across ministries and having an integrated strategy, that's got to be coupled with real accountability. And I love the fact that Giles is saying we're coming out with one package this year, another package next year, and another package the year after. That's what we need for healthcare transformation. And I know Bill Chernetsky's somewhere here, and he knows far more about what it's like to try to drive change in healthcare. But that's my view.
Thanks, Wendy. Huda?
Yeah, I think I wanted to touch on one specific point around how other industries have adopted innovation, right? And they act like industries that need to be able to save money and make money in order to work. But the way we look at healthcare is this like social good. We're like, no, this is just how much it costs. It's what, 61 billion, is it, we spend in Ontario on healthcare? And 40 cents of every tax dollar we pay goes into healthcare. This is not sustainable. We're gonna have to like borrow money from everywhere just to be able to put up with the ballooning costs. So then we have a choice. We can either try to do something about it, or we can keep borrowing money, which nobody wants to do. When we think about it from a provincial level, we actually, as a provincial government, as the biggest buyer of healthcare services, has a lot of room and leverage to be able to go and source a lot of things that you can't build from scratch. So we have this like awful problem in provinces across Canada in general, where we like love starting things from scratch. So we're like, okay, just forget what everyone's ever done. We're just gonna start from scratch and we're gonna do it better. We did this, I harp on about this all the time. We did this with Presto, and it was a giant debacle. The TTC is losing money on that Presto installation, when we could have bought an off-the-shelf solution and saved everybody money and headache and all of that fun stuff. And when it comes to healthcare, we're doing the same thing. We're trying to either we're getting in the wrong place. We're like trying to build consumer-facing things when we shouldn't. We should leave it up to the experts. And we're thinking that private companies are some like evil, like it's almost like I should have like devil horns, because it's like considered that private companies are like evil and they should not operate in the healthcare space, when that's not true. We continue in the healthcare space and otherwise continue to give contracts to non-Canadian companies all the time. Why? Because they're bigger. And how do companies get bigger? When they get contracts. So it's this like vicious cycle where we're just like stuck, where we won't get access to like any provincial like RFPs because they'll go to, so Sykes, which is an American company, operates telehealth in this province. And we do that instead of giving a homegrown Canadian company the same thing. And then we talk about, and then you're absolutely right, the IP problem is important. So now all of our data, everyone who's calling into the telehealth lines can be used, when we're talking about AI, can actually be used to further benefit the province. But now all of that data, all of that IP is owned by companies that are not Canadian. So what are they going to do? Go to bigger markets, which is like, it's ridiculous. It's so frustrating. Sorry.
Giles?
Well, this is a great conversation. I'll say a couple of things. Wendy, and Huda both said the same. Huda said the same thing about. In some ways, we got lots of reports over the years, and they sit on dusty shelves. And it's frustrating, I have to say, as a public servant, because I've been involved in a lot of reports over the years that you would have thought would have gone someplace. And it kind of speaks to a strange culture of inertia or entropy that is part of our mix, and I don't understand why. We often land on the right solutions early and we don't act. I'll just say to me, watching the General Motors announcement yesterday, you could have seen it coming 3-4 years ago. We all knew it was in the cards. Why? Because we're a very high-cost jurisdiction, and there's overcapacity in production in North America. You didn't need to be a rocket scientist to figure out that at some point they were going to say, what are we doing there? Forget the history and everything else. But we didn't act very quickly. And again, there's this culture of we know what the problem is, but we'll sit back and we'll wait, we'll be a bit complacent and see what happens. And I think in the area of IP strategies, again, we've got lots of people who know a lot about IP, patent pools, and patent collectives, but have we got any? And so it's endlessly frustrating. I'll give you a figure that really appalls me and should appall everybody. Although I've talked to a lot of people who don't seem to be appalled by it. But when we do red tape burden reduction, there's one reason why we're doing it. We're not doing it because we have a fetish for burden reduction or red tape reduction, and people want to always give me pins with little scissors on them, and I don't really care about that. What I care about is that we're doing it to cut the cost of doing business in Ontario, because we're very high cost and we're pricing ourselves out of almost every market. And so when I tell people that we are now 46th in North America income per capita, 46th in North America income per capita, with Montana and Oklahoma. Those are our peer jurisdictions in terms of our wealth. And that's happened over the last 15, 20 years, where we've fallen dramatically as an economy. So why can't we afford things? I mean, yeah, we've had massive public debt, consumer debt, and massive household debt and massive government debt, and that's kind of made everything looking pretty good. But when you cut below that, we're actually not that wealthy. And our kids are not going to live in a wealthy jurisdiction, and we don't seem to care. And we've got the solutions in our hands. We know what we have to do, but we don't seem to care. So I think that's a real problem. And, I think this kind of discussion is really important, because if we can't get our heads around doing some of these things instead of just writing reports, we're going to be in some trouble.
It's a great point, and actually I am disturbed and shocked by that statistic, and I hope everyone in the room is as well. So I guess the question becomes, how do we persuade policymakers that the life sciences sector is going to be a driver of wealth and prosperity in Ontario? It's partly about how we set the goal. So in the exercise that we undertook in the audience engagement session, we framed the aspiration in terms of a made in Ontario billion-dollar biotech success story. I guess the question I have is that the right goal for our sector with this government at this time, or is there a different way of framing the policy goal at the end of the day that will yield greater engagement and perhaps different solutions? Wendy, perhaps I'll start with you.
Well, I think it was discussed this morning, and I can't at all pretend I have insight into this government, but I do think that I have some insight into how ordinary people think about these things. And I do think, I say this as someone who's Vice President of Research and Innovation. I love you all, life sciences, yay. However, positioning your case as the life sciences sector and what government and people should be doing for you, if you think about average people, does seem to me to smack, and I think this was mentioned earlier, smack of a kind of elitist, live in a Mars ivory tower, just saying, as opposed to really connecting the stuff that you do with things that matter to the average Ontarian. And we've talked about some of those. So, because I am hugely committed to public health, and I just think we're going to lose it because we can't afford it. And so my whole motivation to drive innovation, to cut costs and so on, is actually so we have money to reinvest, so that we are not, soon the 100th jurisdiction in terms per capita income, because all our kids are, giving half their income to pay for my health care, just saying. So I think that thinking about the framing of this as investments, not just to grow the industry and create jobs, but also to transform healthcare, to provide better access, better quality, better service, whatever those things are, that would be the way, if I were Queen of the World, I would frame it. Now, I don't know, Giles knows much more about the things that are going to resonate with government folks, but I think with the average citizen, we're all, you sit at a table with three people have horror stories about trying to get access to health care or delays or someone who's died because of misdiagnosis. I think the things that everyone in this room does help address those problems. And if you are able to address those problems through transforming the healthcare system, you will grow, the next health tech, BlackBerry, or whatever it is you aspire to, if you see what I mean.
Yeah. Giles?
Actually, I thought Wendy had it dead on in terms of, I think, how to attract attention of this government. I think it is about practical solutions. They are quite concerned about, from everything I've heard, maintaining the high quality of our healthcare system, but at the same time recognizing that, as Huda said, that what the current amount of spending per capita, at least in the growth trajectory it's been on, is not sustainable. So technology is in many ways the answer. I think if they haven't landed on that yet, they will come to it pretty soon. So practical solutions of how to apply technology health technology is really important. And I also think that they have a sense that, if we could grow, I don't think at the billion-dollar company, I mean, that's great. I think if we could grow 20, $100 million companies, that would actually be better. What we do lack we're a strange economy as a mature industrial economy because we actually have very few homegrown large companies. And all the work done by the OECD on frontier firms, which is going to lead in terms of growth of employment and investment and trade and so on. I don't think we have any frontier firms in our jurisdiction. And if you look at we're an industrial economy, but Bombardier is probably our biggest manufacturer, but it's a Quebec-based firm. It's not homegrown. So we don't have much. What we really lack is mid-sized firms. And the work I was doing in my last ministry, we came to realize that we had lost 1,000 medium-sized firms in the sort of 2008, 2012, 15, or 14 period. A lot of that was the manufacturing crunch. So we lost 1,000 out of 5,000 medium-sized firms, and 5,000 medium-sized firms in a jurisdiction our size, $800 billion economy, is not a lot. When you lose a quarter or a fifth of them, that's a significant amount. And so, and we never really grew them back. And medium-sized firms are really important because they're the ones that are going to grow. They're the ones that have the capacity to export. They're the ones that can attract talent. They're the ones that will be investing. And so they're really, really important. And we have this big sort of donut of an economy where that sort of middle is missing. So I think that's something that I would focus on, the medium-sized firms, and then we'll get to the large ones later.
I think there's one of the recommendations that the federal table made was around creating or giving access to build anchor firms within life sciences. So who are those anchor firms that can then have this ripple effect on surrounding economies to create those mid-sized ones, to create those startups? Because often what happens is you'll have a giant company. There's so many ex-RIM people who are now running mid-sized technology companies. And that's important. You need to have great successes where you're going to train up all these people and then they're going to go out and do this on their own and keep contributing to the economy that way. We don't necessarily do a good job. So it's a double-edged sword, really, because we're trying to increase the incentives for private sector investment, but often that private sector investment comes from outside of Canada. And what that means is they'll expand outside of Canada too. So there's so many, .health is venture-backed, and we're all Canadian dollars, actually. But one of the things that U.S. investors who approach us say all the time is, "Oh, we'll invest in you, and you should come to the States." And that will happen to for European investors and so on and so forth as well. So when we're talking about creating anchor firms, I'll bring it back down to finding them the customer, right? So a big thing we can do. It's not all about regulation. It's not all about policy. Some policies don't even exist for stuff that we're trying to do. So we were talking about AI, machine learning earlier. They don't even exist. So it's a little bit of the wild, wild west. What can you do with the right customer in that space to grow quite quickly? And because the biggest buyer of sort of healthcare / life science technology in this province is the provincial government, I think we need to be thinking about, okay, sure, value-based procurement and incentives on the hospital level, fine. What about value-based procurement on the government, on the province's level? What is the province doing to bring in either early-stage companies or mid-sized companies, giving them contracts they need to grow into larger companies, instead of constantly saying, well, we're just going to give it to the American one because, they sold to the American government. Well, you can have a Canadian company that sells to you first.
Yeah, that's a great point. Wendy, you wanted to follow up?
Yeah, there was, the one other thing was, I think that breaking out of the Toronto-Waterloo center of the universe is quite important with this government, both in terms of creating jobs, but also providing services. And if you think of some of the opportunities for test beds and so on in smaller communities, frankly, because running a trial in a jurisdiction like Toronto, way more challenging than if you went to, say, Niagara or some other, or Lake Ridge, or a smaller institution. And I think especially with this government, it's critically important not to be seen as entirely Toronto-centric. And I think the reality is we're not, but sometimes the messaging doesn't come through.
We are out of time, but I'll just, in the last 30 seconds or so, just go across the table to see if you have any final advice for LSO, for Jason, for our sector in terms of building effective partnerships with this government to advance our policy agenda.
I think this has been, actually, my panelists have, I think, supplied you with all the advice you need. I think Wendy was totally right about the way the orientation of this government, so it is an important message that I think, leaping outside of the Waterloo, Toronto, Ottawa, corridor, thinking about Peterborough, thinking about Trenton, thinking about Belleville, thinking about Sault Ste. Marie, and Sudbury and Thunder Bay, places like that. That's where their base is. And so thinking about how you can be helpful there and improve service delivery, I think is really, really important.
Huda, Wendy, anything to add?
Yeah, I would say because there's so much roadkill when it comes to healthcare companies in Canada in general. There's this fear. There's this fear because it's funny, but also because there's this fear for companies to not share any learnings. Yeah. But that actually slows all of us down. So I was in a room with a bunch of healthcare companies of different sizes, and we were all talking about the same problem. So we've all been working on the same solutions just on our own. And there's real power in numbers. So if we can actually get together, share a lot of our learnings, and then get together and go to policymakers or go to bigger companies and make appropriate demands for what we need, that's going to be a lot more effective than everyone going individually. And groups like LSO can definitely fuel that.
Wendy, anything to add?
I just think using the evidence, consultation hugely important. Understanding what people are thinking, hugely important, but we need to actually look at data as well, what works, what doesn't work, set goals, targets, and accountabilities, and I would apply that to government, but also to LSO.
Well, thank you, Huda, Giles, Wendy, for your insight and very practical advice. We are grateful for it. Thank you.